Hi, I'm Bethany Armijo. I have my husband John here with me, and I am going to do speech number 3. Sitting in the oncologist's office, Maggie is waiting to hear if the spot on the x-ray her dentist took is cancer. Having had a previous bout with breast cancer, Maggie has a justified anxiety. Her oncologist walks in and tells her, "No x-ray a dentist takes could show me any kind of cancer." She pleads with him to do additional testing given her history. He agrees and does the testing, finding a small tumor in her brain. The 3D x-ray her dentist took may have just saved her life. Maggie sees the importance of routine dental checkups now more than ever. This is a true story of a patient whom I encountered during my 13 years experience as a registered dental assistant. The importance of seeing a dentist goes far beyond cleaning your teeth and checking for cavities, as you can see in Maggie's story. Though teeth cleaning and cavity checks are important, disease and cancer screenings take the importance of seeing your dentist to a higher level. According to the Centers for Disease Control, over 30% of Americans did not see the dentist last year, meaning they did not take advantage of the screenings for disease and cancers that dentists do on a routine check. With oral cancer on the rise, value must be placed in screening for it. Early detection of oral cancer gives the patient an 80 to 90% survival rate. Today we will discuss some of the excuses people have for not visiting the dentist and their solutions, as well as the importance of routine dental checkups. I hope that through our discussion, I am able to encourage you to see the value in visiting a dentist annually. There are many excuses as to why people don't visit the dentist. U.S. News reports the 2 highest factors for not seeing the dentist are the cost of dentistry and the fear of dentistry. Others have stated they don't have anything bothering them, so why go? These are all valid points to a certain degree, but there are solutions to all of them. The cost of dentistry can be a dreaded expense, especially for those with low income and no dental insurance. There are many options available for reduced cost dentistry. The National Institute for Dental and Craniofacial Research, NIH, offers information on where to find reduced cost dentistry. The NIH suggests looking into clinical trials available through their website. You can check what category you may fit into and apply directly through their site, nih.gov. Dental and hygiene schools are another resource that offers low-cost dentistry. Students are able to perform procedures to gain experience under direct supervision of a licensed dentist. There are also state and local resources available. By contacting your state or local health department, they can give you information on those services available in your area. Another option for those who may not qualify for the income-based services is financing. Many dentists offer low-interest financing, some of them even 0% financing. The fear of dentistry is legitimate for many people. There are many fears associated with dentistry, such as pain and bad memories. Dentistry has evolved through time. There are now dentists known as minimally invasive, which means the dentist's philosophy is to preserve as much of the natural form of the tooth and tissue as possible. They use the same approach through all of dentistry. The equipment minimally invasive dentists use help ease the fears and subside the bad memories for many patients. They use lasers, replacing the use of traditional drills. This also eliminates the need for anesthetic in most cases, meaning no need for needles. These types of dentists do the least invasive procedures, meaning if you can get away with a filling, they will do that instead of the more invasive crown procedure, causing the patient the least amount of discomfort. Minimally invasive dentists will also use digital x-rays, reducing the amount of radiation the patient receives. Some dentists also have the newest in X-ray technology known as the 3D cone beam scan, providing the dentist with comprehensive pictures from the head all the way down to the neck within 10 seconds and no pain to the patient. The final excuse of "there's nothing wrong with me, so why should I see the dentist?" can be answered simply: prevention. According to Delta Dental, signs and symptoms of diabetes, HIV and AIDS, leukemia, Lou Gehrig's disease, and many oral cancers may be detected through oral displays first. Allowing a dentist to perform routine evaluations can catch diseases, some life-threatening, in their infancy stages. Just as Maggie was able to have her brain tumor detected through the new X-ray technology her dentist offered. Many cancers and diseases are asymptomatic, meaning they show no signs or symptoms. Early detection can save your life. Gum disease is also a serious disease, diagnosed and treated by a dentist. Gum disease can lead to heart disease and stroke. Now that we see that there are solutions to many of the excuses we make in avoiding the dentist, we can focus on the importance of seeing a dentist for prevention. Give value to your health and that of your family. Make visits to the dentist part of your routine annually. It can save your life or the life of a loved one. Early detection of dental decay or cavities and gum disease can save you money. Cavities and gum disease take time to develop. If you are seeing a dentist routinely, you can either prevent them from forming or detect them at an early stage, lowering the cost of treatment. Early detection of cancer and other diseases that show signs in your mouth can save your life. The Oral Cancer Society states that over 40,000 people will be diagnosed with oral cancer this year in America. Of those, over 8,000 will die. That is killing one person every hour over 24 hours a day. Those at risk for oral cancer are not older men with a history of drinking and smoking like previously thought. Young people are at an increased risk now more than ever due to the human papillomavirus, HPV, a sexually transmitted disease that mostly affects teens and those in their 20s. We will watch a news clip of a dentist explaining the importance of early detection of oral cancer.
Non-smokers are being diagnosed. The cause? Human papillomavirus, or HPV. It's most often transmitted by sexual contact.
It's very frightening.
Lancaster dentist Matthew Friedman says the problem is that oral cancer is often detected in its late stages.
By the time you see something clinically in the mouth, the survival rate is very low. The 5-year survival rate is 30%, because it starts under the tissue, and you don't see it for a while.
And he says the surgical treatment for advanced disease can be devastating.
As we can see, quick, pain-free screening for oral cancer in all age groups is important in detecting oral cancer and other diseases that could be life-threatening. We have a tendency to push aside that which we don't value. Do you value your life? Do you value your health? I urge you to evaluate the importance of early detection of oral cancer and other oral diseases. Think of the diseases you can prevent, such as gum disease, heart disease, and cavities. Think of the money you can save with prevention and early detection. Think of the 80 to 90% survival rate for those who have an early detection of oral cancer. Though detection of brain tumors is not common, diagnosis of other oral cancers and diseases occur daily. So go ahead, stick your tongue out to your dentist in the name of early detection and save your life.